World NAS Day. In fact, this is the first time that NAS Day is being celebrated. And why we talk about NAS? When you say NAS, it is non-alcoholic steatohepatitis. And in fact, NAS is one of the family of non-alcoholic fatty liver disease. When it starts from simple fatty liver disease and goes to non-alcoholic steatohepatitis and it ends into cirrhosis. So friends, what is fatty liver disease? Fatty liver disease is the one where you find excess fat deposition in the liver, and when this fat deposition causes damage in the liver, it goes to the stage of non-alcoholic steatohepatitis, and when damage is further done, it goes into the final stage which we call as a cirrhosis. And in fact, all the consequences of fatty liver disease occurs when it goes to the cirrhotic stage. Now, who are the patient when you suspect that this could be NFLD? The patient with obesity, excess weight, patient with diabetes, hypertension, abnormal lipid profile are the one who are at the risk of developing this disease. So, friends, how to diagnose fatty liver disease? To diagnose fatty liver disease, we have three sets of things. One is the imaging, and ultrasound in fact is the most important and common modality which can pick up about 90% of fatty liver disease. However, patients who are very obese, ultrasound will not be of that great help. CT scan and MRI do not have the sensitivity to pick up the fatty liver disease, but MR spectroscopy is a specific type of MRI which can pick up fatty liver disease and in fact quantify the fat, but it is required in a small number of patients only. Liver biochemical parameters are very important. We have various types of fibroscan meters and other things which can be used by your specialist doctor, but simple thing is that your liver function test shows abnormal transaminases, that is SGOT and SGPT, and your doctor can add few more tests, viral infection and other tests to know that this fatty liver is because of non-alcoholic fatty liver disease. Alcohol history should be taken in all the patients. Now, once you have been diagnosed to have fatty liver disease, now what are the modalities to treat it? Now, the simple modality is the lifestyle modification and treatment of underlying disease. If you have hypertension, treat your hypertension. If you have diabetes, control the diabetes. If you are obese, you have to control the obesity, and in fact this is the most important treatment modality. If you are obese, if you decrease your weight at least by 10%, in fact 80% of your problem can be solved. Exercise is very important, but you need not do the vigorous exercise. If you exercise moderately for 30 minutes in 5 days in a week, that is sufficient. In fact, studies have shown that if you do simple cycling for 4 weeks without altering your lipid profile, your NAS can be controlled. So, lifestyle modification are the most important, and at present they are the only parameters. There are no specific drugs. However, there are a lot of drugs on horizon, because in fact this is the most common cause of liver disease not only in India but world over now, and hence there are a lot of research going on. So friends, you may after 6 months you may find that there is some drug which is effective, but at present, believe me, the most important thing for cure is in your hand. Your exercise and your control of weight and diet is the most important one. So friends, to summarize, in fact fatty liver disease is one of the common disease. It can be diagnosed with simple means of fibroscan, ultrasound and blood, and once it is diagnosed, you have to take advice of a gastroenterologist or a hepatologist nearby and follow them regularly. And in fact, as I said, lifestyle modification is the most important thing. Thank you.